Good morning. We are going to call the summit to order. I am Mike Leventhal with Tennessee Men's Health Network, and on behalf of my colleague Judy Seals Togbo and our entire Men's Health Network organization, I would like to welcome you to the 14th annual Men's Wellness Summit. For the past 14 years, Tennessee Men's Health Network has been hosting this event in person, but due to circumstances beyond our control, we are bringing you this year's event virtually. So thank you for logging on and participating in what is shaped up to be an outstanding agenda. June marks Men's Health Month, a special awareness month to spotlight the health of men and boys. It's a time for us to talk about, and more importantly, to take action when it comes to men's health. We take action by participating in events like this and by scheduling that long overdue appointment with your healthcare provider. Guys, you know who I'm talking to. Please visit menshealthmonth.org for more information and tips on ways to improve your health, mind, body, and spirit. The Men's Wellness Summit would not be possible if it wasn't for our partners and collaborators. I'd like to take a moment now to thank them, and they include the Men's Wellness Summit Planning Committee, Tennessee Cancer Coalition, Walgreens, American Cancer Society, St. Jude Children's Research Hospital, Methodist Hospital, Church Health, Meharry Medical College, Vanderbilt University Center for Research on Men's Health, Families Matter, Common Table Health Alliance, Fraser Community PTSA, and thank you for all those behind the scenes that have worked to ensure that we have zero Zoom glitches and hiccups. Keep our fingers crossed. As I mentioned earlier, we have an outstanding agenda, and I know we're excited to begin, but first, just a couple of housekeeping items. A survey will follow the event, so please fill that out and complete it and send it to us. Door prizes will be awarded at the conclusion of each discussion, and our grand prize, a 42-inch high-definition TV, will be awarded at the before we adjourn. Lastly, we welcome your questions. We love your questions, so please do not hesitate to ask them in the chat. But due to time constraints, we're going to be able to answer them as they come in. So if you have any questions that you'd like answered, we will be happy to take them to the panelists and have them email you a response. At this time, I want to introduce Mr. Vance Stacks Jr., who is serving as our honorary MC for this year's summit. Vance?
Hello, everyone. How you doing? Welcome to the 2021 Men's Summit. Is it turn over to me, sir?
Yes.
All right, thank you. Let us bow in a word of prayer. God, we just thank you for your grace and your mercy. God, we thank you for your love and kindness. God, we thank you for all that you've done for us. God, we thank you for this day, this summit, these words that are about to come forward for men to understand that their health is important. God, let this word fall on good ground, that it may form into the men's mind that we are important and that our health is important. We thank you for this day. We thank you for the Men's Network, and we ask that you bless us as we go forward. In Jesus' name we pray, amen. Bless God. Today, we're going to, let me tell you a little about myself. I am a 3-time breast cancer survivor. Just finished my last dose of radiation, April the 29th of 2021. I started a nonprofit to help out in this area. We will begin to offer direct cremations for the cancer patient that's transitioned. And we want to offer also honor last requests for those that have transitioned from cancer. So I'm excited about this work. I'm excited about this men's network this morning. We have some great speakers. We have some great information for men. So if you're listening to this summit and your husband or your son is nearby, have them to come to the table, have them to come to the computer screen to get this very important information on men's health. So we're about to kick off the 2021 Men's Summit. And the first speaker we're going to have is Dr. Derek Griffin. Dr. Derek Griffin is the founder and director of the Center for Research in Men's Health and Profession at Vanderbilt University. While at Vanderbilt, he led the development and dissemination of the Tennessee Men's Health Report Card in 2014, in 2017, and 2020. Under his leadership, the report card has become a model for it, replicated by national efforts in Australia and Ireland. In July 2021, he will move to Georgetown University to become the founding co-director of Racial Justice Institute, founder and director of the Center of Men's Health Equality, and a professor in the Department of Health Systems Administration, Oncology, trained in psychology and public health. Dr. Griffin has published over 140 articles, and he was recently quoted in ProPublica, Time Magazine, and the Washington Post. I present to you none other than Dr. Derek Griffin, the director of the Center for Research for Men's Health.
Well, good morning, all, and thank you for that very kind introduction. It's a pleasure to be here with you. Let me just jump right in. I know we're trying to keep on time, and so let's just start. So I'm going to basically present the core findings from the report card itself, and just kind of provide an overview and highlight. A lot of these will resonate if you're not in Tennessee or from Tennessee. A lot of these should resonate with you across the nation. The patterns are generally pretty similar, but you'll also see different patterns across Tennessee. And we'll do some work comparing sort of men of different ages in Tennessee, and then the three, as they call it here, grand divisions of the state, East, Middle, and West Tennessee. So before we get into that, let me, again, we thank you for Reverend Axe, for that introduction and sort of for going through some of the history. One of the unique things about Tennessee is that we're basically the only municipality, if you will, that has regularly sort of monitored and provided a report on the health of men in that unit. Whether you're talking about a local community, whether you're talking about a state, nation, basically across the globe, this is one of the few, and that's why it's been replicated in other countries, and we're looking to do a national one in the United States in the near future. The data for this particular report card is from 2018. There's always a lag between when we can present data and when we're able to get it from our partners at the Tennessee Department of Health. And it's usually coordinated more generally by the Centers for Disease Control and Prevention. And so we want to make sure we thank them, excuse me, the Tennessee Department of Health for the data, and to highlight that our other partners, of course, the Tennessee Men's Health Network, Harry Medical College, Vanderbilt University Medical Center, and all of the other folks, which I'll show you in just a second. This is one of the first times we're actually going to present data on Hispanics and Hispanic men in a broader way. Just to be clear, Hispanic is an ethnicity, not a race. So you can be both Black or white and Hispanic. So it's not what you would call a mutually exclusive category. So there's some overlap between the Black category and Hispanic, the white category and Hispanic. Nonetheless, we'll present it as best we can, but we can't tease that out, or they didn't tease that out with the data that we're presenting. And unless otherwise noted, the report we're talking about data from men 18 and older in the state. So I know this is a little small to read, but it's just highlighting the range of people that it took to pull this together, from the very extensive advisory board team. Of course, Mike Leventhal has been sort of a key anchor to that as long as I've been part of this and before. And many others that, again, in the interest of time, I won't name, but have been part of this. I do need to make sure I acknowledge my team at the Center for Research on Men's Health at Vanderbilt, who were really helpful in sort of pulling all these pieces together. So let's start with the basics. We know that men's health is really rooted in this idea that is driven by the data. part of the whole motivation for studying men's health, for addressing men's health, is not just the moral imperative of everybody trying to be healthy, but we also know that men in general across the globe, in the United States and certainly in Tennessee, tend to live shorter lives than women and have a shorter life expectancy than women. And so that's no different here in Tennessee. The life expectancy for men in Tennessee in general is about 5 years shorter than for women. The life expectancy for Black men is particularly short. Again, it's not a unique feature to Tennessee, but life expectancy for, you see these groups, that the life expectancy for men overall was about 73 years. For Black men, it's 69.4. And that should just highlight to you, and for white men, it was 73.9. And so for women, it was 78.6 overall, 78, almost 79 for white women, and 76.9 for Black women. The reason that matters is because it suggests that there's something going on for race and for the way that race and gender intersect that we need to better understand. There's something about the experience, the life of Black men that we have to pay more attention to, and that really is not just about race, it's not just about gender, but we really need to understand how the two interconnect in ways to affect our health and well-being. Within the grand divisions, we know, well, in general, heart disease is the leading cause of death for men in the state. Across Middle, West, and East Tennessee, that's the case. And we see that basically patterned here. We, again, broke out Middle, West, and East Tennessee. Again, for those who are not in Tennessee, you can sort of think of it as the anchor for West Tennessee is Memphis. For Middle Tennessee, it's Nashville. For East Tennessee, it would be Chattanooga and Knoxville. So just think of it sort of that way. These are the geographic areas around those. And so it'll be important to sort of see the patterns generally across leading cause of death are basically the same across the three grand divisions of the state. When you start to break this down, this is where it gets interesting. So young adult men, those we characterize as 1834, West Tennessee, for Middle Tennessee and East Tennessee, accidents, automobile accidents and so forth, were the leading cause of death. In West Tennessee, this is the only area of the state where assaults, including homicide, were part of the leading cause of death. And so, or the leading cause of death. And so there's something going on. I'm sure this is not news to anybody who's in West Tennessee, the Memphis area, that, homicide is such a huge issue, but we do need to pay particular attention to that, and that that's something that is unique to this particular area of the country. Area of the state. Again, when we get to sort of middle-aged and older men, the patterns look much more similar, where you have heart disease, even for middle-aged men being the leading cause of death. So we do have to pay attention to that. Accidents and adverse events, this is more likely to be both in terms of automobile accidents and so forth, but also job-related accidents. So again, you see that in younger and middle-aged men, that they may have more accidents in those kind of areas. Excuse me, and not surprising for older men, the leading cause of death are things that you expect to be issues by age, heart disease, cancers, and so forth. When we think about the changes that have happened over time, one of the things that we'll note is that cancer, the rate of dying from cancer has actually decreased. So it's one of the areas where we're actually doing a lot better. We seem to be doing worse over time, and that sort of, if we look at this over a 10-year period, we seem to be doing worse in the areas of accidents, COPD, diabetes, and Alzheimer's disease. Now, Alzheimer's disease tends to be higher in women than men, but it also seems to be something that we have to pay more attention to in men as well. When we look at these, break these things down by race and ethnicity, we again see similar patterns for the leading causes.
For its contribution to.
I'm sorry. Keep going. Okay, I'm gonna keep going. Yeah, the leading cause of death for men across race and ethnicity, again, is generally the same for the first leading cause of death, but you also see that the second leading cause of death for Hispanic men is different. It's more accidents and adverse events, which suggests that, and if you look at this more specifically, Hispanic men tend to be a younger population. So there are more of them that are in that 18 to 34 group. White men tend to be an older population in the state. And so this may speak to the higher rate of those who are doing kind of manual labor type jobs and having accidents as a result of that. Couple other just quick notes. Let's get through this. When you get to cancer, because I know this is going to be talked about some later, this is where we've seen some progress, and yet it's still not a lot of progress. And regardless of the progress that we've seen, we actually are still seeing racial disparities among men in these dying from cancer. So the first graph is you can see is all cancers. The orange bar is basically for Black men. The blue is all races. The darker blue or black is white men, including Hispanic. Well, Black is including Hispanic as well. But you see that the gap has basically, it's closing some, but it is persistent, and we are sort of seeing that this has been difficult for us to close over time. When you look at prostate cancer, you see an even greater difference, and we need to pay more attention to that as well. When you get to colon and rectal cancer, again, a similar issue, but then you're also seeing in this case, some of the differences actually growing. Because the rates of colorectal cancer mortality are not quite the same as high as, say, prostate cancer, it's not affecting the overall number in the same way. But you're seeing these racial differences in colon and rectal cancer, such as what Chadwick Boseman died from, being higher. So we need to pay more attention to that. I know it's, difficult thing to broach as a topic, but we do need to pay more attention to colorectal cancer and how we address those issues. The last one, lung cancer, which is of course largely due to smoking. We also have to pay more attention to. You see the racial differences growing if you compare it over this basically 40-year period, that the number of smokers is actually decreasing, but the mortality, the rate of difference between Blacks and whites, and Black and white men, is actually growing. And so we need to figure out what we need to do to better reduce the rates of Black men smoking, using other kinds of things that are leading to lung and bronchial cancers, and how we need to improve those differences as well. Men's health is clearly not all about Black men, and I don't want to make this, when I talk about race, to only make this about Black men. We do need to pay particular attention to the fact that when we look at these issues, things like the opioid epidemic that we've had in Tennessee over the last several years, one, it's an important men's health issue, but it's also something that we know is higher in white men than it has been in Black men. And the mortality, first of all, we need to think about opioid and other substance use issues as a men's health issue, if for no other reason, the rates tend to be higher in men. And if we don't look at what is it about being a man that actually is contributing to these poor health issues, that we need to do better. It's not just about our behavior, but there are other things that we need to build into this picture. The stressors, the experiences, the lack of return on good schooling and education and those kinds of things also have potentially a differential effect. And so we know that, again, you see from the graph below that white men have consistently had a higher rate of dying from opioid addiction than opioid overdose than Black men. In West Tennessee, you see, I just sort of broke this out by Grand Division. The highest rates of mortality from opioid addiction was actually in East Tennessee. And so again, we need to pay attention to some of the regional differences that we have not really sort of discussed and addressed in the ways that we need to. Traumatic brain injury is something that we added new this year that we hadn't before, but is also really important to recognize that these kinds of issues, from whether it's concussion related injuries from sports, whether it's from, again, car accidents and so forth, men have been affected by these and certainly tend to be dying by these. at far higher rates than women. And so we need to, again, look at what are the sources of these, what are the types of injuries that men are getting, and how vehicle crashes, of course, were a big one for this.
Last minute wrap up.
Yes.
1 minute wrap.
Okay. And then the last one is just looking at sexual health, that we need to pay attention to the fact that HIV rates, while they're, tending to decrease, or at least certain HIV rates tend to be decreasing, the rates of other sexually transmitted infections tend to be actually increasing. So we need to pay attention to that. And we know that those are concentrated in certain groups of men. There are lots of things that I'm sure Mike Leventhal and the rest of the group will talk about in terms of ways to improve men's health. We just don't need to look, we need to look at behavior. We need to look at going to the doctor, but we also need to look at things like vaccinations, other types of tests like colorectal cancer, the things in our neighborhoods, and even things like education as important steps that we can help to use to improve men's health and well-being. So with that, I'll close. Thank you.
Thank you very much, Dr. Griffin, for your information. And for those of you that are listening, this is being recorded. So any information that you missed from Dr. Griffin, you can go back at any time and listen to it. And he had some great points, some great information, especially on information here from the state of Tennessee. Our next presenter is Dr. Paul Warras. Dr. Warras, PhD, received his doctorate in social policy from Hellier School of Brandeis University, currently holds the rank and titles of professor, vice chair, director of community-based research, Department of Family and Community Medicine, Meharry Medical College. Dr. Warras previously held academic appointments at Charles R. Drew University, UCLA School of Medicine, USC School of Medicine, and California University, Long Beach, Department of Social Work. While at Meharry Medical College, Dr. Warras has helped to promote the support health services, research in cancer prevention and control diabetes. Dr. Warras has served on over 30 grant review panels for the Center of Disease Control, MCHB, National Institute of Health, and the Office of Minority Health. We're glad to have Dr. Warras here with us. Dr. Warras, it is in your hands to speak the way you want to speak to us, sir.
Okay, I think we're having a problem with Dr. Warras. I don't know if he's logged on or not. So Vance, why don't we go ahead and move forward with our agenda? And if Dr. Warras is able to join us, we will get right to him.
Okay. Do we have Katrina Kimble?
Yes, sir, I'm here.
How you doing, Kimble? It's in your hands, ma'am.
All right, we're going to go ahead and get ready to spin this wheel. We're going to share this screen with everyone. Good morning, everybody. So glad you're here with us. So let's see who's going to be a winner this morning. All right, the wheel has spun, and our first winner for today is Mr. William Oleman. So congratulations, William. You are the first winner of a $25 gift card to the Vitamin Shop. I turn it back over to you, Mr. Sachs.
Vance, you're muted, Vance.
Okay, thank you. I'm sorry, I was muted. Congratulations to the winner. And if you don't want the card, sir, I will be glad to use the card at the Vitamin Shop. So thank you very much, Katrina. See you back on the next go round.
Yes, sir.
Our next participant is Reginold Thompson. They call him Mr. Hollywood. I don't know why they call him Mr. Hollywood. I guess he'll explain to you why they call him Mr. Hollywood. Mr. Hollywood is about to give us his testimony on his journey with prostate cancer. Mr. Hollywood, Reginald Thompson, I'm sorry, Reginald Thompson. I already got hooked on calling you Hollywood. But Reginald Thompson, we are in your hands, sir.
All right, can you hear me? All right. Hello, Memphis. Hello, world. Well, let's talk about prostate cancer. First, I like to say, they call me Hollywood, but my real name is Reginald Maurice Thompson out of Memphis. Miss Lily Mae Thompson, first and youngest son, a picture of perfection, a man with a distinguished personality and dignity. Ain't that beautiful? Well, let's get back to the real deal, prostate cancer. Well, 9 years ago, I was diagnosed with prostate cancer. But maybe 8 years before that, I was diagnosed with an enlarged prostate. And during that process, my doctor always told me I had to keep in touch with my PSA numbers. Well, for years, my PSA numbers was very low. Everything was good. Then all of a sudden, they started to rise. Now, one thing about us men, we do not believe in going and doing what we're supposed to do for is medical. Men, you got to change that. You got to get checked. You got to get checked. So my words are, what time is it? It's time to get checked. Men, you got to stay up on it. Now, this is the problem with a lot of men. The first thing they say is, I ain't going to no doctor and let him put his finger on me. No. Men, that is stupid. That is stupid. You got to get tested. Now, that is the way they find out about your enlarged prostate. And that enlarged prostate usually moves up into, if it's not being able to be controlled, up into cancer. Your cancer is done and found through the blood. But men, you got to get tested. Like I have been 9 years cancer-free. But I'm gonna tell you where I messed up at. Well, when I was going to the doctor, the PSA number was good, I stopped going. And I had a new primary doctor. And the first thing they asked me after he gave me a physical was, when the last time you had your prostate checked? I said, doctor, I didn't get my prostate checked. My prostate been taken out. He said, well, your numbers is high. What you mean high? So I contacted my doctor. I went. PSA numbers was out the roof. Now, that word of cancer was back in my life. Well, I went through 7 weeks, 5 days a week, radiation. Well, I'm doing great, going to work, working out, riding my motorcycle. But men, please get tested. Go to your doctor, get tested. Now, this is the deal. If any ladies are listening at me, please listen at me. This is the deal. We as men do nothing on our own. But with your help, that man will get help. Baby, you got your prostate checked? No. Well, we need to get it. Well, okay. You make the appointment. You make the appointment for him. You go with him. And the best thing with me going through my program of prostate was my wife, was my backbone. My girls was my backbone. Ladies, you got to make that man go. Now, men, this deal about it's gonna take your nature. Some lose it, some don't. But let me tell you something. When it was first told to me that I had prostate cancer and I had to do this and I had to do that, the first thing I told that nurse, ma'am, whatever it takes. I done had more sex in my life than you carry around with you. But like I say, it's not about the sex, y'all. It's not about it. I am here to be able to play with my grandchildren. Hopefully one day play with some great grandchildren. But men, prostate cancer is a very serious thing. It moves slow, but it's deadly. And if you let it take over, that's when you have a problem. Early detection, you right on time. But I don't understand when I was told how it moves with us black guys, with us black men. But it is what it is. But what you got to do is take care of yourself. Do what you got to do. Go to the doctor. You got to go to the doctor. Ladies, I'm gonna say this again. Men need your help. Men need your help. It's nothing like being there with somebody that cares about you, believes in you, backing you up. It's something else, y'all. I've been through it. I'm going through it again. I'm gonna be all right. Because see, one thing about it, two things for sure. I got a wonderful family behind me, but most of all, I got my God. And without him, there is no hope. So that lets you know I got all the hope in the world. But I'm not gonna hold no more of your time up, but I just want you to know. Get help, get tested, and remember, what time is it? Time to get tested. Y'all be careful, y'all be safe. If don't nobody love you, Hollywood love you. Y'all take care.
Thank you, Mr. Thompson. You heard what he said. We're gonna quote Mr. Hollywood. What time is it? It's time to get tested. Thank you, Mr. Hollywood, for your words of encouragement. And thank you for telling us and sharing your story, sir. All righty, our next speaker is Carol Manor.
Vance, you're muted.
It's not showing muted.
Oh, here.
All right. Carol Minor, how you doing?
Hello, everyone. Hello, everyone. Thank you, Vance, for queuing me in. I'm going to share my screen. Share here.
Miss Minor, also, you have until 58.
Okay. I am going to, David, I think you told me how to make sure I'm in presenter mode. Are you just seeing my slides, everyone?
It looks great.
Okay, no notes. Okay. Thank you again. I am Carol Minor. I am a program coordinator with the HPV Cancer Prevention Program at St. Jude Children's Research Hospital. It is a brand new program to St. Jude. I'm actually here in Memphis. I just moved back here. It's home for me. I moved back at the beginning of the year to take this position. Previously, I had been with the American Cancer Society for many years, covering the cancer sites that Dr. Griffith talked about, colorectal, lung, prostate, even breast cancer, and tobacco cessation, working in that arena too. But I'm so glad to be here at St. Jude working in the HPV realm specifically, because at St. Jude, traditionally, they treat pediatric cancers that cannot be prevented, but the HPV-related cancers that are a result of the HPV virus can be prevented with the HPV vaccine. So we're real excited about that. And I just want to be able to answer a lot of your questions, educate you on some information you may not know about it. So we're going to go on and get started and talk more about it. I guess I can control this myself. Yes. Okay. And if you have questions, kind of save them toward the end. Hopefully I'll answer a lot of them now through this presentation. And what we're going to do is talk about what is HPV. Some people are not familiar with it. I'll tell you about how common it is and how people actually get HPV and what it causes. And people want to know, do I have HPV? But I think the most important thing is, how can you prevent HPV? And we're going to talk about that now. HPV is the human papillomavirus. That's the medical name for it. And it's a very common virus for both men and women. I think that's the first important thing. It is a virus that affects both men and women, and it can lead to 6 types of cancer later in life. You can really but the protection starts in adolescence. Children need to get the vaccine at the recommended ages of between 11 and 12 years old, but they can also get it as early as age 9. And I'll be talking about that throughout this presentation, why those ages are important. I'm trying to get my screen where I can see the whole thing. I'm gonna go to my notes here so I can see the header. The question is HPV common? The infection is so common that nearly all men and women at some point in their lives will get the HPV virus. So I want to make that 85%, kind of break it out and let you know what that looks like in numbers. So you can see that nearly 80 million Americans currently, right now, are infected with the HPV virus. So that's about 14 million Americans, and it includes some teens as well, and they become infected every year. So that's why it's just so important that we look at this vaccine for our children. And if you're a student on the call, someone in that age range, you need to listen to this information as well. I'm trying to advance it. I'm sorry. Okay. I'm sorry, I've skipped a. Okay, I'm sorry. So the next thing is, how do people get HPV? These are just the facts. You contract the virus through intimate skin-to-skin contact, and you can actually get the HPV virus through various forms of sex. It can be transmitted without any signs or symptoms, so it's hard to even pinpoint where you got the virus. If you have been intimate with more than one person, you can't really say where you got it from, one person or another, because they may have exhibited no signs or symptoms. And it is possible to develop symptoms years after you get the virus. So that's why it's so important. Let me go back to those ages. To get the virus as an adolescent, as a preteen, between the ages of 11 and 12, and as early as age 9. So the next question becomes, what can HPV cause? Every year, about 36,000 Americans are told that they have HPV-related cancer. That's about 200,000 women who will develop precancers of the cervix. And for both men and women, that can be about 500,000 who will develop lesions or sores related to their HPV infection. Now, most people are going to pass the HPV infection within about 2 years, but sometimes those infections are going to last longer and they're going to cause certain cancers. And you can see here for women, that's going to be cervical cancer, vaginal cancer, and vulval cancer. For men, it's going to be cancer of the penis. But for both men and women, that can be anal cancer and cancer of the mouth and throat. And there's really no way to know if you're going to lead to health problems with some of these precancers. But I will tell you that people who have weakened immune systems are more likely to develop certain health problems if they have not been vaccinated with the HPV vaccine. So another question that people will ask is, how do I know if I have HPV? Well, there's really no test for men for sure. There is no recommended test, but for women, only for cervical cancer will you be able to find out if you have the HPV virus. And that is done with an HPV test in conjunction with a Pap test. So again, it goes back to early prevention with the HPV vaccine as an adolescent is so important. So you won't run into these issues with HPV associated cancers. And then the question becomes, how can HPV be prevented? I'm sorry, there's noise going on behind me, but more than 90% of the HPV cancers can be prevented by getting the vaccination. And that's really good news because the vaccine has been available since 2006. And there's been about 15 years of research and monitoring to let you know that it's very safe, it's effective, and it's long lasting. And the CDC continues to recommend, along with other organizations like the American Cancer Society and St. Jude, that you do the routine vaccinations for HPV in those recommended age ranges of 11 and 12 and as early as age 9 to prevent HPV cancers. And this is the important piece though. For the HPV vaccine to be most effective, you have to complete the series. It's a 2-dose series before age 15. And you want to get that done before a child is ever exposed to the virus. That's what's so important, getting the vaccine before a child is ever exposed to the virus. So again, what are the reasons to get vaccinated? It's because this is cancer prevention. This has nothing to do with anything else but cancer prevention. And that's what we try to educate parents on, remind doctors about when they give a strong provider recommendation, to just let that parent know and that child know that this is about cancer prevention. And I think the two strong points to emphasize around the vaccine is that this vaccine prevents certain cancer-causing infections and precancers. Again, it's the lesions and the sores that will show up in the areas that can be affected. The anal area, for women, vaginal area, and for both men and women in the mouth and the throat. And also the vaccination helps prevent against HPV-related cancers. Another important point is getting that HPV vaccination for your child is so much better than trying to treat an HPV-related cancers. And I know for the clinical people on the call, you definitely understand this. And we want parents to really understand this too. You have children who are, going to grow up, be men and women, start families. And because the virus can lay dormant for years and show up as cancer so much later, who wants that for their child? You know, they've started their family and then here they're dealing with a cancer that they really didn't have to deal with because there was a vaccine available. So we really promote the recommended ages, and we really promote as early as possible because we want to take any questions around, you know, how you get the vaccine out of the equation. The earlier you get it, the uptake is so much better in younger children. So that's why we promote as early as age 9. Again, early detection works best. Most children will only need 2 doses if they get the vaccine before age 15. But again, you've got to complete the dosing series. And just like the COVID vaccine, other than the Johnson & Johnson vaccine, where it was just 1 shot, we had to get 2 shots. But you've got to complete the series. And now the good news is the HPV and COVID vaccines can be given at the same age for children as young as age 12. I think that is the latest recommendation from the ACIP about giving the vaccine in conjunction with the COVID vaccine. That's been a question that's come up because of the pandemic. You know, it's ruled our lives for the last 18 months or so. So that's very important to note that the HPV and COVID vaccines can be given simultaneously. One of the questions that comes up a lot is, you know, people want to know, especially parents, they want to know about the vaccine. It's been approved since 2006 by the FDA. And for 15 years, it's been studied, it's been monitored, and there continues to be research behind it to effectively say that it is safe, it's effective, and it gives long-lasting protection. And that's a conversation that parents and even adolescents can have with their pediatrician or their family practice doctor if they continue to have questions about it. And somewhere during this the summit, I'm going to actually put up the link to our website, and I'm also going to put up links to other websites that give you information about the vaccine, its safety, and the recommended ages when you need to do that. So these are the things that you can do. This is the information I want to leave you with. Get vaccinated. If you have a child in the recommended age range, get them vaccinated. And if you're not vaccinated, if you've not been vaccinated and you're in that age range as an adolescent, do that. Because what we want to do is really normalize the message behind the HPV vaccine. It's cancer prevention. That's all it is. It's cancer prevention. How you get it is how you get it. But the large message is we are talking about cancer prevention. And also we want to share the facts that the HPV vaccination, it's safe, it's effective, it's long lasting, and it prevents 6 different types of cancer. As parents, guardians, grandparents, you want to know that you've done the best that you could do to protect your children. And this is one of the easiest things you can do, is giving them the HPV vaccine. So that's the information I have. I want you to see, this is my email address. This is the link to our site at St. Jude about our department. We have articles posted there. Just recently, we signed on with all of the NCI cancer centers across the country on a letter to get back on track with the HPV vaccine, because the pandemic has not just the HPV vaccine or immunizations, but just healthcare overall has put a lot of us behind on the things that we need to do. So it's just important, though. It was that important that all of the NCI centers signed a letter supporting getting back on track with the HPV vaccine. So we're proud of that, and we are moving the marble to really get children vaccinated against HPV-associated cancers. So if you have any questions, Vance, did you want them to ask now or wait until the end of the session?
I think it's going to be a question and answer period at the end to be able to respond.
Okay.
Thank you very much, Ms. Minor, for all your information. We thank you for spending your time with us in your day. This is a great day outside, Saturday. The sun is shining, but you're here with us sharing your information. And we want to take this time to tell you thank you for what you brought to the table, Ms. Minor.
Well, thank you. And I just want to say I am just a true supporter of, prevention, and, education is so important. So I just, please, I put my email up there for anyone who wants to get in contact with me, because this is just such an important subject when it's about something, it's about prevention, something that we could do ahead of time. So please feel free to email me or go to our website.
Thank you very much again. And again, we want to thank you again for participating in the 2021 Men's Summit. You have a great day, Ms.
Thank you.
All right, we're at a part where everyone can participate. Katrina, Kimble, are you ready?
Yes, sir, Mrs. Thatcher.
All right, we're in your hands. We're in your hands again.
All right. Well, again, thank you everybody for being with us today. We are going to spin this wheel and see if we can get us another winner today. So we're going to go to full size so I can see it really well. Again, my name is Katrina Kimble. I'm with Methodist Labana Healthcare, and I am so glad to serve on this committee. So let's see if we can get us a winner. All right. So again, we are giving away a $25 gift card to the Vitamin Shop. Our very last drawing will be for the 42-inch television at the end. So let's spin the wheel. The winner is Nathaniel Boutte. So we have us a winner.
All right, Nathaniel Boutte, you are the winner of this drawing, and congratulations to you. I'm pretty sure we get in touch with you to give you your prize. Thank you again, Ms. Kimble, the prize lady. We really appreciate you.
You're welcome.
Have a good day. Well, I'll see you in just a minute.
Yeah, we got 3 more to do.
Thank you very much, Ms. Kimble. Our next topic is colon cancer. And we have Dr. Ramachandran. And we're going to allow him to tell you a little about himself before he gets into the colon aspect. Dr. Ramachandran, the floor is yours, sir.
Thank you so much. Appreciate the introduction. And my name is Dr. Rajesh Ramachandran. I'm a gastroenterologist with Gastro One in Memphis, and I joined the group in 2016. And it's my privilege and pleasure to be here as a part of this summit. Colon cancer, colon health, men's health is extremely important, to me and to all of us, and that's why we're here. And I've had the privilege of being part of this summit for a few sessions now, and look forward to seeing these sessions continue to grow and continue to spread awareness. I've enjoyed hearing all of the speakers prior to me who have disseminated some wonderful, wonderful information, and I look forward to building on that and honing in on what I see and do on a daily basis, which is dealing with colon health. So I have titled this talk, Colon Cancer, what you need to know. And I want to hit a few key bullet points, and I would also love to be able to answer any questions either at the end of this session or later on as well if something comes to mind after the fact. So let's start with how common is colorectal cancer. It's the third most common cancer that's diagnosed in men and women. The American Cancer Society estimate for the number of cases of colorectal cancer in 2020 is over 100,000 cases of colon cancer and over 40,000 cases of rectal cancer for 2020 alone. Death rates. There is a piece of good news here, which is that death rates have been dropping for colorectal cancer for several decades, and that's something that we want to continue to build upon. Some of the reasons for this include the fact that polyps, which are growths in the colon that can form and develop into colon cancer, these are detected more frequently with screening methods, and we're going to talk about that in just a second. And these growths can be removed before they can develop into cancers. Secondly, cancers are being found earlier at a time when they are easier to treat. The treatment for colorectal cancer has improved over the last several decades. And at this point, we deal with more than 1.5 million survivors of colorectal cancer in the US. So that's a number that we're excited about, but that's also a number that we ultimately don't want there to be survivors of colorectal cancer. We want people to not have colorectal cancer in the first place. So moving on to risk factors, there are some things that you can do today to change the risk of developing or getting colorectal cancer. And there's some things that we don't have that much control over. So I just wanted to hit on those points. So let's first talk about risk factors that you can change. Being overweight or obese is a risk factor for not just colorectal cancer, but for other cancers as well. And along with that, sometimes not being physically active as well. A third risk factor is a diet that is high in red meats and processed meats, smoking, as well as moderate to heavy alcohol use. So these are all behaviors, these are all risks that should be discussed, with your primary care provider in terms of how can I start reducing my risk of developing colorectal cancer. Shifting gears to risk factors that we don't have that much control over, that includes being older, our age. Secondly, a personal history of colon polyps or colon cancer, a personal history of inflammatory bowel disease. Some of you may be familiar with ulcerative colitis or Crohn's disease, which are inflammatory conditions of the colon that can confer a higher risk of developing colorectal cancer. A family history of colorectal cancer or polyps, typically in first-degree relatives, so that would include someone's mother or father or a brother or sister. We deal with an increased risk of colorectal cancer in people who may have an inherited syndrome, which is rare, but these can sometimes confer an increased risk of colon cancer as well. Having type 2 diabetes, which is a risk factor that is sometimes seen as not changeable, but oftentimes, with diet, exercise, that is a risk factor that could potentially certainly be mitigated. And then racial and ethnic background, and I think this was touched on earlier in Dr. Griffith's wonderful talk earlier this morning about racial disparities and increased risk of colorectal cancer in certain populations. So can colorectal cancer be found early? Yes. Yes, and yes, absolutely. And that is known as the process of screening. So colorectal cancer screening, or screening in general, is the process of looking for cancer or precancer in people who have no symptoms of the disease. And I'd like to dwell on this point for a little bit, because oftentimes I speak to my patients who come in and tell me that they feel great, they feel wonderful, they don't have any abdominal pain. They mention no changes in bowel habits, such as constipation that they never had before, or diarrhea that they never had before, no blood in the stool, no belly pain. And we share a moment of joy that they're not having any of these symptoms. And then the topic shifts towards screening, and they'll tell me, well, I feel great, so I don't really need a colonoscopy. And that is where my intervention usually occurs. And the whole point of screening is to, again, detect a process before it becomes a bigger problem. And so, similar to that old adage, a stitch in time saves 9, we're looking here to find and detect an issue before we're dealing with the actual prospect of colorectal cancer. So I'll tell my patient, I'm glad that you feel great, and I'm glad that you feel well, and I'm glad that you don't have symptoms, but you still need a screening test for colorectal cancer. And that's something that I'd like to emphasize to everyone here today, that it is not about symptoms. Oftentimes symptoms are what drive one to their provider in the first place to say, hey, something's going on here, I want to get it checked out. But screening is the process of looking for a cancer or a precancerous process in people who have no symptoms at all. So regular colorectal cancer screening is one of the most powerful tools that we have. I'm going to be talking about some of the methods that we use for colon cancer screening. But screening can often find colorectal cancer early, when it's small, when it hasn't spread, and when it certainly might be easier to treat. And with screening, we can also find polyps, and polyps are growths in the colon that over time can develop into colon cancer. And these polyps, in the setting of certain tests, can be removed so that they don't have a chance to ever turn into anything more concerning. So why is colorectal cancer screening so important? It's because it's a leading cause of cancer for both men and women in the United States. And when colorectal cancer has been found at an early stage, before there is concern for spread, the 5-year relative survival rate is over 90%, versus when cancer has spread outside the colon or rectum, survival rates are lower. And about 1 in 3 people in the United States who should get tested, who are eligible for colon cancer testing, have never been screened. And that is a statistic that I hope to change, by joining summits like this. But, we should really be, talking more about colorectal cancer screening and getting it done. Just like how Mr. Hollywood had mentioned earlier, it's time to just go ahead and get it done and get the screening done. So for people at average risk, for people who don't have symptoms, who don't have a personal or family history, who don't have an underlying history of inflammatory bowel disease or a rare inherited syndrome, the American Cancer Society recommendation is to consider regular colorectal cancer screening starting at the age of 45. There's a few different ways to achieve colorectal cancer screening. The first set of tests are stool-based tests, which I'll talk about. And then the second test is a direct visual exam that actually looks at the colon, and that's called a colonoscopy. Screening should continue through the age of 75. And for folks who are between the ages of 76 and 85, the decision to be screened is based on it's an individualized decision based on other health problems, based on possible life expectancy, and also based on prior screening history and what has been found previously on prior stool tests or on prior colonoscopies. So stool tests, these are generally tests that you may discuss initially with your primary care provider. Some of you may have heard or even gone through what's called a FIT test or a fecal immunohistochemical test. That is a highly sensitive test that checks for hidden blood in the stool. We also have a different type of a stool test that can look for DNA changes in the stool as well as for hidden blood in the stool. And so the FIT test is a test that should be done annually. The multi-targeted DNA stool test should be done every 3 years. And the benefit of stool tests is that it's certainly better than nothing. And all of these stool tests do not have any direct risk to the colon. There's no bowel preparation needed. There's no time off of work needed. The sampling can be done in the comfort of your own home. But sometimes stool tests, as with pretty much any test in medicine, is not perfect. There can be polyps or growths in the colon that are missed despite having a negative stool test. And you can also have false positive test results where the test indicates that, hey, there is something going on in the colon. And then when we actually do a colonoscopy to take a look inside, things look fine. So one important point to keep in mind is that if the stool test is abnormal, then the next step is generally a colonoscopy, which is the direct visual exam of the colon. So with a colonoscopy, this test looks at the entire length of the colon and rectum with a small, thin, flexible camera. And this is a procedure that I perform every day, several times a day, as part of colon cancer screening, looking for polyps and growths in the colon. So we have special instruments that we can pass through the camera, and this allows us to take samples or biopsies. It also allows us to remove polyps or growths in the colon when we see them. This test as well, a colonoscopy, can sometimes miss small polyps. There is a bowel preparation needed, which involves taking a purgative to basically flush you out. Obviously, I can't do my job, which is to visualize all the walls of the colon, unless the colon is completely free and clear of stool and food and fecal material. And so the bowel preparation is a necessary part of this test. This test generally requires some time off from work on the day of the exam, and it requires, or generally we use anesthesia so that you feel comfortable and you don't feel any pain or discomfort during the procedure. The colonoscopy is the only test that can find a problem and also potentially fix the problem at the same time. And it can also help identify other issues with the colon as well. For example, hemorrhoids. Sometimes people will mention bleeding, which doesn't always have to be because of a colon polyp or colon cancer. There are many benign causes of rectal bleeding as well. And so we can look into that with a colonoscopy because it's a direct visual exam. So those are my key messages as far as colon cancer screening. In terms of what I'd like to leave you with, I would love to emphasize, please get colon cancer screening, whether it's a stool-based test or whether you elect for a colonoscopy. Have a discussion about it with your primary care provider. Talk about it with your family. Talk about it with your friends. ask them about their experiences. I would urge you to discuss any doubts or fears that you have about colon cancer screening with your provider. There are many, many rumors out there. Dr. Google is a famous doctor that I deal with every day, who often scares my patients unnecessarily. And so I compete with Dr. Google every day to actually dispel myths and rumors that in many cases are not true. But my experience has been that people will generally Google symptoms and automatically assume that they have a cancer going on. And many times, most times, that is not the case. So certainly do your research, but at the same time, I encourage you to bring that research to the table and let's discuss it together. Colon cancer screening saves lives, and that's an important take-home point. And better late than never. I do colonoscopies all the time on people in their mid-50s, late 50s, 60s, and 70s. So, many times people will feel, well, I missed the boat. I didn't get it done when, my doctor asked me to do it so many years ago, and that's okay. That is completely okay. No one is going to fault you for that. We'll just say, let's, go ahead and get it done and move on. And so it's okay if you're late for screening, get it done, and I encourage you to discuss, with me, with your provider, about any questions that you may have. I see colon cancer probably on a weekly basis, with colonoscopies. And no matter how much I see and deal with it, it never gets easy to see. And it's always saddening for me as a clinician to see colon cancer, because many times the question is, for my patient, have you ever been screened before? And oftentimes the answer is no. And then the next question that I have is, well, why not? Why weren't you screened? What could we as a healthcare community have done better? And to that, oftentimes my patients will say, you know what, I was scared, or I thought I was going to be in pain, or I thought it was going to hurt a lot, or I just didn't want anything stuck up my bottom. And that to me is really, really disappointing to hear, because on the one hand, we're talking about a small, tiny, thin camera that is being inserted into the rectum to evaluate the colon. But isn't that a whole lot better than having to deal with potential surgery and chemoradiation and dealing with cancer? And is the cancer going to come back? Is it completely gone? I would take a colonoscopy or a stool-based test to look for colorectal cancer any day, as opposed to the actual treatments that can be offered for cancer. So I leave you with the sincere plea to please prioritize colon cancer screening, as well as all of the other age-appropriate screenings that have been discussed by our wonderful panel thus far. And I look forward to answering questions that any of you may have, if not now, then even afterwards. And I'm sure the panel organizers would be happy to share my contact information so that I can answer questions for all of you. Thank you so much for having me here today.
Michael?
Yes, thank you, Vance. Dr. Ramachandran, every year, Tennessee Men's Health Network presents an award to a physician in the state of Tennessee that has gone above and beyond for not only Tennessee Men's Health Network and the men's health movement, but for community's health at large. And this year, I am proud to announce that you have been named our 2021 Tennessee Men's Health Network Doctor of the Year. So congratulations, and thank you for all of your hard work. Again, not only just for the men's health movement, but for the betterment of the health of Shelby County and West Tennessee.
Thank you. Thank you so much.
And when I come back to Memphis, probably in 4 weeks, it would be my honor to present you with that token of our appreciation. Of course, I would happily do it if we were in person, but since we're doing the digital summit this year, it'll have to wait. But once again, thank you for everything that you do, and we certainly look forward to working with you in the future.
Thank you so much for having me. That's an absolute privilege and honor, and look forward to continue to working with you all to promote men's health and colon cancer awareness.
Absolutely. Vance?
If all the participants will unmute their phones and their computers right now and put your hands together with me, and would you please applaud Dr. Ramachandran for his great award and being our Doctor of the Year.
Thank you so much, everyone.
Put your phones and things back on mute. Miss Kimble, you're up again. Prize lady, come on down, Miss Kimble.
Yes, sir. We are back. We are back. I hope everyone is enjoying this summit. They are sharing some amazing information with us. And you know, when you get information, it's not just for you. So you got to go back and take it to your village. So share it with your family, share it with your friends, and just continue to, so we can have this legacy of health and wellness. So our previous winner is actually a member of our planning committee, and he is so gracious. He wants me to do another drawing and give that gift card to someone else. So we're going to do 2 names really quickly. So let's see who's going to be the winner this time as we spin the wheel. Our first winner is Harry Tyndall, and then we're going to do another one real quickly. So we're going to close this out, and we're going to spend one more time. And thank you, Nate, for giving that gift card to one of the participants. We really appreciate that. Amber Schaefer is our second winner. So these are our drawings for this time. Back to you, Mr. Stats.
Thank you again, Miss Kimble. And congratulations to Harry Kimble and Amber. Congratulations on those wins. Our next speaker is speaking on lung cancer. I read his bio. I would, if you would, Dr. Jason Porter, if you would go ahead and give us a little bit about you and what you're about and what you do, and then go ahead and talk to us about lung cancer. We're in your hands, Dr. Jason Porter. Can you hear me now? Can you hear me now? Okay, good.
Yeah, we've got you, Vance. Paging Dr. Porter. Okay. Dr. Porter may have stepped away, so.
Well,
Vance,
let's do this. I got a text while we were talking. They said I didn't mention the name of my nonprofit while I was talking. And I just want to go ahead and plug that while we're waiting on Dr. Porter. And the name of my nonprofit is called Pink Ain't What You Think. So if you see that anywhere, males breast cancer awareness, and that's me. And please donate and help us out. All right, go ahead. What you can say, Mike?
I was just saying, Vance, that we're going to have to probably move ahead in our agenda. We'll get back to Dr. Porter when he becomes available. He may have been called for some type of an emergency. But Vance, why don't you take us through the agenda and to our next guest?
Okay. The next guest will be Big Herc. Is he available? He's ready? Is he on here?
He's on. Is it that time? It is that time.
Is that time? Unless you want to go ahead and do it. We have another spot for a drawing again.
Well, Vance, I was curious, can you tell us a little bit more about Pink Ain't What You Think and how you came up with that clever name?
Okay. As for the people that don't know, I am, again, a 3-time breast cancer survivor. I was in remission for 6 years. And in 2019, while attending a family reunion, I
I'm sorry,
Vance, you're
Vance, you
muted
muted
again.
yourself. Vance.
can you hear me now?
Yes.
Okay. The second time it came back and I went to the doctor and I did chemo after surgery. 6 months later, went back for a checkup and it was back the third time and I had radiation. I completed radiation April 29th, 2021, which happened to be my 51st birthday. So I celebrated my birthday and I went out to a restaurant here in Memphis. And I had already had the name in my head, but kind of leery about naming my company, the name Pink Ain't What You Think. So I went to the restaurant and I had on a full pink suit. I walked in and there was the elderly woman that looked at me and she looked away and as if she was disgusted. There was another couple that did the same. And then one young lady said, and she saw a cake in my hand. She's like, is today your birthday? I said, yes, ma'am. But more so over than that, most important than that, I am a 3-time breast cancer survivor. And at that point, everybody in the lobby began to cheer like, oh, yes, congratulations. Oh, that's why the pink suit. Oh, okay. And when I sat at the table, it just became very clear to me that the name of my company is the name that's needed. Pink ain't what you think. And I want to let men know that it ain't only women that's dying from breast cancer, it's men that's dying as well. And the reason we have such a high mortality rate is because we don't have a lot of symptoms. And the symptoms that we do have, they're not painful. So if it's not bothering us, we're not going to bother it. And thus, that's why our numbers are so high. The same symptoms that the women have, we have. The puckering of the nipple, the little things like that. So that we wouldn't notice. And since it don't have any pain, we don't bother it. So I want to encourage every man on this webinar to go and get checked. The same check that the woman does by feeling, if you feel a knot or anything that's discomforted right there, go get a check. It may not be hurting, it may not be causing you any discomfort, but let's get it checked before it does start causing you a problem. And like the doctor said on here, screening is important. So the life that you save may be your very own. So that's how my company came about. That's how the nonprofit came about. Pink Ain't What You Think, a male breast cancer awareness.
Thank you. Thank you, Vance. I'm just curious, what were your symptoms? How did you discover that you had male breast cancer? I mean, for you being a 3-time male breast cancer survivor, I mean, first of all, being a 3-time cancer survivor is an incredible story. But tell us about your symptoms. How did you discover that you had breast cancer for the first time?
The first time I had a car accident. I had a vehicle accident and they did a chest x-ray and they noticed a little blotch. And once they noticed the blotch, they sent me to the doctor. The doctor did the test.
Vance, you muted yourself again.
Okay. So I went to the doctor and they noticed that it was a knot. He did a biopsy. The biopsy came back negative. It was nothing. 2 weeks later, I was at home and I felt my chest again and the knot had come back the size of a golf ball. I mean, it was huge. So I went back to my primary care physician and he recommended me to go to another oncologist. That oncologist did a biopsy and then came in the room the following week and advised me that I had breast cancer. And I used an expletive and explained to him, no, women have breast cancer. He's like, no, you have breast cancer. And the following week I was in surgery. That was my first surgery. Spent 2 or 3 weeks in the hospital. And that was the beginning of my journey. The second time, it makes you feel very lethargic. Like if you go to bed at night at 9 o'clock and you wake up at 7 the next morning, it's like you hadn't had any sleep. Your body's still tired. That was one of my main symptoms. I didn't want to do anything on a daily basis. I didn't want to get out of bed. So I knew something was wrong with my body. I didn't have any of the puckering of the nipple or the growth or the nipple puckering out. I didn't have any of that. None of the signs, none of the leaking and nothing like that. I just had a knot on the inside that was about to attach itself to my bone. It was under my muscle and about to attach itself to the bone. The second and third time that I experienced breast cancer, they both was in the third stage. So as of April 29th, 2021, I am cancer-free.
All right, we got to put our hands together for you now, because that's one heck of an accomplishment. And next time I see you, Vance, I'm gonna have to rub you for good luck, because that's an amazing story. Because Dr. Porter has been called away, our friend Nate Boutte has decided he would pitch hit, and we're very grateful to have Mr. Boutte here, Dr. Boutte. And Dr. Boutte, the floor is yours, my friend. Tell us who you are and what you do, and yeah, take it away.
All right, good morning, everybody. Hopefully I'm not on mute.
No.
Okay, great, awesome. So my name's Nate Boutte, Dr. Nate. I am a pharmacist. I work with Walgreens Specialty here in Memphis. So we focus on a lot of different disease states, but one of the big disease states we do focus on is oncology, and that's in general. One of the other things that I do in my role is I've sort of become like the face of COVID-19 for Walgreens. I do a lot of little YouTube informationals for the company. And because of that, I've been doing some news interviews and things like that. So in light of the fact that we haven't spoken about COVID, and COVID is very, very big right now, just take a couple minutes to just kind of talk about COVID and men's health. So I, like many of you, I'm sure, watch a little TV. And a couple weeks ago, it was Saturday Night Live or something, I saw something about COVID-19 and erectile dysfunction. And I was like, wait, what's this about? So I actually looked it up, and actually there is some reports, or there was a study done that possibly COVID-19 could cause erectile dysfunction. And what it was is, when you actually dive into the study, is that a lot of the things associated with erectile dysfunction are also associated with high risk for COVID-19. So we're talking about obesity, heart disease, cholesterol, all those things that are high risk categories. Diabetes are things that increase your ability to have erectile dysfunction, also increase your ability to have a hard time with COVID-19. I say all these things to say, because when we talk about erectile dysfunction, as Hollywood mentioned earlier, that's something that gets men's attention, right? So like, no men want COVID-19 because it could possibly cause erectile dysfunction. So one of the things that we talked a lot about, and we've been talking about over the last year or so, is how do you protect yourself from COVID-19? And of course, one of the biggest things that we do is like, well, we mask up, we wear our masks, protect ourselves from COVID-19. But now there's a vaccine, right? So everybody's heard about this vaccine, and there's a lot of rumors. Like Dr. Rajesh was just speaking, he has to fight Dr. Google all the time. I'm fighting Dr. Facebook, because I saw on Facebook that if you get the vaccine, they injecting you with the chip. So I'm here to tell you that there's no chips being injected when you get the vaccine. Also here to tell you that the vaccine is safe, it's effective. And in general, this is just in general, men suffer more from infections, like they have a lower rate of fighting infections than women do. So they have seen that with COVID-19, because it is an infection, it's like other infections, it's worse in men than it is in women. So as Dr. Griffith spoke about earlier, we're talking about men's health. COVID-19 is hitting men harder than it's hitting women. So again, it goes back to what we were talking about, like Ms. Miner said earlier, prevention, prevention, prevention. So the easiest way for us to fight COVID-19 is for us to get vaccinated against it, right? So that protection that the vaccine provides will help eliminate all the questions, eliminate all the talk about things that could go wrong if you get COVID-19. So, you know, we talk about healthy eating, we talk about diet, we talk about doing all those things. This is a really, really simple thing that's literally, you go in, you get your vaccine, and you're kind of done with that process. And that eliminates a lot of fear, a lot of concern, and things of that nature when it comes to your individual health and COVID-19. So I don't know, I don't want to go too much time. We got Big Herc coming up, and he's the man. I started following him on Instagram the other day and had some great things out there, but I will throw it back to you, Reverend Stacks, to go ahead and get our introduction in here.
Got it. Thank you. Reverend, got you.
You're muted.
Thank you for all that you do, Boutte. Also, we want to take the time to welcome Big Herc, Marcus Timmons. He's going to tell us a little about his story. He's going to give us a little introduction about himself. Can you hear me, Mark?
Yeah, I can hear you.
All right. We're in your hands. The floor is yours. Take us a little higher.
All right. Everybody calls me Big Herc 916. I mean, my real name is Marcus, but I go by Big Herc 916. And I have a YouTube platform known as Fresh Out. And also I have a YouTube platform known as Big Herc 916. And I've been doing these platforms now for about 8 years, and we have over 250 million views as of date from 2008. And so my journey is basically about an ex-felon who took his life and changed it. And I used prison as my spiritual awakening. I was sentenced to 120 months in federal prison for bank robbery in 2000. But prior to my bank robbery, I had also been in trouble as far as selling drugs. I had been involved in a robbery. And so I had been in jail before, but it wasn't like I was a bad person, because prior to that, I was a straight A student. I was a 4.0 student. So going through school, I always was really good in school. I was always very active as far as physically exercising. One of my dreams prior to getting in trouble was being a skateboarder and a BMXer. So that was like my hobbies growing up. I had, I was always a very kid that was always very busy. Growing up, my mom had me real young, 14, never met my dad, but I was raised with good values with my grandparents. Grandfather's military background, so I always had that instilled in me. And, I had a stepdad, but didn't really get too much fatherly support on that end. But nonetheless, I was always good in school, excelled, stayed out of trouble, up until about 14, when I moved back to the neighborhood, which I grew up in Sacramento. I moved to a part of town that was more active with the streets. And so I went from being a kid that was skateboarding to being a kid that got more involved in the streets, because I was a latchkey kid. My mom worked 2 jobs. I had a little brother and sister to take care of. So I started getting involved with things in the streets out of curiosity, and also trying to find my identity, which I know a lot of kids are searching for an identity when they're, young, and you don't have a male role model in your life. You don't have a male mentor. So I got in trouble at 15, selling drugs, went to juvenile hall. After juvenile hall, we moved to a neighborhood that was it was really nice, actually. Mom got married, we moved to Orange County, Huntington Beach. It was very suburbia. I did well out there, stayed out of trouble, graduated, and rather than move, my mom, because the military, they moved around a lot. They moved back east, and I didn't move back east with them. I went back to Sacramento. Bad move. Back to Sacramento, got right back in the mix of things, was going to junior college, ended up getting in trouble again, got caught up in a home invasion, helping somebody else out. Ended up doing 2 years, 8 months in California Youth Authority. And I also went to fire camp. So I got to actually work on the fires, and it, gave me some values, but as a young man, 18 to 21, you're still searching for your identity. So I was still on my journey. So after I got out of California Youth Authority fire camp, I was pretty much out on my own, just kind of doing my thing. Went back to Southern California, worked in doing extra work, worked in clubs, went back to college, got back in the mix of some other things that were pretty negative, which eventually led to me catching the bank robbery case. And the bank robbery, when you get involved in something like that, it's not something that just happens out the blue. This is a progression of bad choices, of just being influenced by different things that aren't productive. And so your mind is easy to grasp a negative idea because it seems feasible for the type of mind state it's in. Because if you're doing good, you're not going to entertain a bank robbery. If you're hanging around people who are positive, people who aren't in the streets, that would seem so far-fetched. Like when I think about it today, never would I ever recommend or tell somebody, hey man, let's go rob a bank, because that's the furthest thing, with the mindset I have now. But I could just, when I look back and I'm like, wow, man, how'd I even entertain that thought? But I was 24 and nonetheless, I entertained it. High-speed chase, ran across the freeway, spike strip, helicopters, probably 20-something cop cars. And when I got arrested on the boardwalk, I ran up a freeway embankment and I got arrested on a boardwalk looking out towards the ocean. I thought to myself, I had an epiphany. I'm like, why didn't I stay in bed, man? Why'd I leave the house today? And it's like, I knew right then it was game over. So instantly, it's like I had a change of thoughts, and I'm like, I wish I could have had these change of thoughts a couple hours prior, because now I had to face the consequences of all my actions. So going to court, dealing with all that stuff, I was looking at 12 years. As I got, once I got situated, I started researching the law. I ended up knocking off 2 years off my sentence. And at that point, it took me on a journey of spirituality and studying the law and helping other people fight their cases and research law and stuff like that. So that's pretty much what I did during the whole time I was locked up. Is I became a student, and on my journey, I found more like 2 mentors who took me under the wing. And this was the first time I really had people, males in my life, that kind of gave me a sense of what it was like to be a male and my potential. And I can remember going to the law library, and my first mentor, he called me up to his cell, and it was an older white guy who was doing 35 years, and he was an ex-Vietnam vet, and he was in there for manufacturing synthetic heroin. And he's like, man, what are you doing? I see you going to the law library every day. I said, man, I'm trying to look for a way out of here. I said, maybe they messed up. Maybe I can get out early. He says, I see you going every day, man. He said, here, let me give you something. And he gave me a Black's Law dictionary, and he gave me some legal documents to read over. He gave me excerpts from the United States Attorney's Manual. He gave me some congressional acts. And I used to read that stuff every night, all night. And I would lay up restless, like I couldn't sleep, because I got duped. And what I mean by I got duped was I played into the program, which I see a lot of young people playing into, as far as the program that you see that's projected by the media, whether it's the imagery, what you feel makes you a man, just the different perceptions of being a man, or being down, or being real, or keeping it 100. And I stayed away. Like, a lot of guys didn't really like me too much, or didn't care for me, because they felt like I thought I was better than them, or I was kind of bougie because of how I carried myself, the way I articulated myself. But I realized this wasn't me. I was raised better than this. I had values, and I realized I made a grave mistake. So I just continued studying. And I also met another mentor, an older Black male, who taught me about being a Black male, and about just spirituality, and just having a sense of self, sense of confidence. And these two individuals stuck with me, and I carried that through my whole time. But it was crazy because we would sit there and be on a top tier looking down, and he would point out people. He said, you see these guys down here, and you see grown men, 40s, 50s. I mean, the average person where I was locked up at in Lompoc initially was doing about 30 years. And then you had guys in there 4 or 5 lives plus 100. You had crazy sentences. I mean, people were getting stabbed in there every week. I mean, it was a very violent place, and it was dark, and it had old cells. They call it the dungeon. And he would point it out, man. He's like, man, you're better than that, man. He's like, you ain't like those guys down there. See, they're running around and they're involved in all that. He said, you have so much more potential. And so from that point on, I always pushed myself and realized that I had been selling myself short. And one of my mottos is never settle for average. And from, like I said, that time forward, I always maintained a mentality that I'm not an inmate, I'm not a convict, I'm just passing through here, and I'm not going to let anybody steal my dreams. So, I read every day. I wrote a couple books in prison. I came up with the show concept Fresh Out while I was in prison. And my thing was, when I get out, I'm going to be self-sufficient, and I'm not going to allow anybody to hold anything over me that keeps me from being successful. So I took that mentality. I owned up to my actions. See, one of the problems with a lot of people in prison, they blame, oh, I didn't have a dad. Oh man, my mom. Oh man, I'm black. Oh man, the system, the man, this and that. I didn't do none of that. And a lot of guys were mad, like, oh man, this and that. I'm like, dude, I'm in here. I made some bad choices. I got to accept that responsibility. Once you do that, your life changes. And you realize that whatever reality you want, you can create. So I got out, and from the time I got out in 2008 to now, I've been basically creating my own reality. And I started doing Fresh Out with a partner of mine in 2008, in 2013 that I met in the gym. And I told him about my show concept, and we didn't know nothing about Hollywood or about producing or filming. But I said, man, I think, this show, if we put the time in, I mean, if they got a show like Cops that has 20 years of episodes and they're multi-millionaires, I said, we can do a show about ex-felons who have changed their life and show it to be a positive impact. And maybe we can affect some of these young people and give them something to look forward to. So we shot our first episode. And eventually my partner learned how to edit and film, and we bought our own equipment, and we basically created a full-blown production company. And then with Big Herc 916, I started a whole conscious movement of positivity motivation to bring awareness and a positive element to the Black male in particular. Even though a lot of people, I mean, I get people from Kenya, I get people from Dubai, from London, from Canada, from Finland, young men, all races that have watched my show and grew up on it and changed their life. And I tell people, man, don't let anybody trick you into thinking that because of something that happened in your past, you're handicapped. That's the big spin right now. You can't do this because of that. Oh, 100 years of this made you this. Man, do you know what happened in these other countries? When you look at history, they don't tell history. They don't talk about US history. You talk about world history and what's happened around the world to people who have been less fortunate. If you took that and you ran with it, then nobody would ever get through any type of glass ceilings. So for myself, I learned that I had to pull back from a lot of things, a lot of people, and change a lot of my association. And as you do that, you realize you become more independent, but you're also more alone, because a lot of people don't want to see you go any further than where you are, because once you start rising above them, now they look at you like, oh my God, this guy's actually doing more than I'm doing. And it makes them have to now quit being average or what they're considered just existing and maybe assert themselves. So it creates animosity. And I tell people, as you grow in life you'll see that people you thought were your friends or people who thought supported you actually are hoping that you don't get to the point where you want to get to or reach your goals. So you have to be really conscious of that and understand energy. So I really push in my whole motto as far as health, because I've been working out since I was 14. I've always been somebody who's very studious. I don't drink. I don't smoke weed in my free time. I mean, I have nothing against it, but that's not my thing. I don't vape. I mean, I always felt like I want to be the top of the food chain as far as what I can be, because at the end of the day, when I hit the dirt, I don't want to be looking and see a reflection of myself of what I could have been and what I didn't reach. And I look at that other person maybe in an elusive state, and they're like, you know what, Big Herc, had you applied yourself, you could have been that guy. And I'm looking at that guy, like, who's that guy? He's like, that's you. That's Super Herc. Super Herc continued on his path and he excelled, and now he's this particular person, and he did this, this, and this. So that was one of my biggest things also in prison was, man, I have a sense of urgency, just like I feel I have a sense of urgency now. It's like, what if there's a limited amount of time and I don't take advantage of all the tools I've been given in the spiritual journey? So I try to tell young people, hey man, get you a habit. I mean, not a habit, but get you a hobby. Create a vision board, set goals for yourself, you know, do something that's productive so you can figure out what it is you're good at. We were all blessed with a talent to share with the world and bring something to humanity. But most people never even get past the fact that they just get up, eat, go poop every day, and that's it, you know. And it's like life is more than that, you know. And it's just like when I talk to even like some people who, you know, parents who talk about their kids and like how they can't reach their kids, but the kids listen to my show, and these kids, after they watch my show, they kind of look at life differently. And my thing is unlocking these different mental, these mental limitations, and having these people really see that you are the creator of your own reality. You can literally go from being whatever it is to, it's like sky's the limit. And when I talk to people who are very successful, 40, 50 million, 100 million, they don't see limits. They don't, it's just a totally different conversation. And it's amazing, but this is something they don't teach people. They teach you religion, they teach you education, and they teach you just basic survival skills. But there's another skill that's involved, that's a mental skill, that's about your mind limitations. And that's one of the things that keeps everybody right now in such a stagnant state. And especially, like I said, just the programming, when you see stuff over and over and over again. And I know, like we talked about the demographics of a lot of the people that would be tuned in, when you're seeing what's around you and you're limited to just that experience, you don't realize that beyond that, there's just so much opportunity. And you have to build a dream. You know, back in the day, people would play fantasy games. You would maybe, you know, create like a little, your army man or whatever the case may be, or you'd read a magazine, and people don't do that anymore. And they're trapped in these little bubbles. But when you get out and you see what's out there, it just opens your mind up. So I always tell people, man, never limit yourself to your surroundings. And if you got to step out from your family, your immediate friends, and be ostracized, that's a part of just you growing. And that's a part of life if you want to be successful beyond what you're currently doing. And I'm not saying you got to be a billionaire or have a helicopter. All I'm saying is maximizing what your purpose here on earth is. You know, I hear people all the time, you know, Big Herc, man, you talk all this, and man, you know, you have to sell out to do this. You ain't got to sell out. You ain't sell out. I'm not running around here dancing in a dress. I'm like, dude, I'm saying you could be you and still be successful, but it's like, you got to get out of that mind state. You got to get out of that where, you know, you've been programmed to think that if you have a certain level of success, you're doing something wrong. You know, you don't have to be ignorant, and you don't have to be a guy who's so-called some thug in order to represent success, especially in the Black male genre. And I feel like it's an all-out assault on young Black men and masculinity and just being responsible. I mean, you know, it's like, where's the guys with the suits on, the guys who are taking their kids to school, the guys who are reading to their kids at night, the guys who, you know, have professional jobs. There's guys who are Black men or architects, who are business owners, who aren't holding money as phones and showing pistols. I mean, why is that such a big thing right now? Why is it just, and it's just being promoted daily? And it's like you're fighting a battle, but I feel like I got to stay loyal to myself, because I've seen what it did to me, and I've seen what other youngsters got tricked into, older guys who are in prison who wish they would have seen it. So that's my big message with Fresh Out and with Big Herc 916, and it's trying to show another direction and to bring awareness that you're limiting your potential. You don't even realize it, and you're using things that they've told you that are affecting your ability to be successful, but they're lies. They're lies. I mean, you can easily say, oh, because of this, we can't have this. Man, I met a guy the other day, a blind Black guy from Philadelphia, who's a certified Pro Tools engineer, the only one in the country, and he's a public speaker who makes $6,000 a day, and the guy's produced tracks for some of the top hip hop artists in the world. And he's Black, and he's blind. So I tell somebody, what's your excuse? You have no excuse, man. People have excuse. Oh, I can't do it because it is. Oh man, my mama. Man, dude, stop with the excuses. Everybody has one. Take responsibility. It's like, you know, when I see stuff like that, I'm thinking, damn, what am I not doing? I'm like, man, my game is not even is scraping the surface. So, you know, a lot of these kids need to hear stuff like that, and people need to see this and need to, you know, and need to take a conscious account for their actions and quit trying to point the finger, man, and have responsibility. And in my house, when I grew up, nobody in my family, my grandfather grew up in the South, and he told me about one time when he was picking cotton and about living in Georgia and about how racist it was, but he never said that, oh man, you can't have this because of this, you can't do this because of that, and this and that. And he didn't have no dad. He's raised by his grandmother. He ended up buying 4 or 5 houses, retired from 2 jobs. He worth 7 figures, you know, and he's, you know, took care of everybody's family. So when I look at him, and I'm like, even, you know, in his vision, he took it to the next level. It's my job to take it above and beyond that. But he never told me, you can't have this because of this, or you can't do this because the system, you know. This dude grew up around people picking cotton. So my message is, man, stop making excuses, you know, take conscious responsibility and invest in your children, man. Invest in your health and your family and values to elevate your future. And that's how you make changes. You know, we got to get out of that mindset.
Yes, great information. One of my old pastors used to say one thing that always stuck with me for years. And he said, I got to pass, you got to pass. And when I get to heaven, there's going to be thousands of people that had a pass. So don't let your past be your sticking point.
That's right.
Great information, sir. And there's a saying I also tell my son, when you get in the car and you look up there up there in the window, there's a small rearview mirror. And that's a small rearview mirror for a reason. When you're looking back, you're looking at the small things that's already gone. And there's this big open window shield in front of you so you can see your bright, big future. And I make that acknowledgement to him all the time, to them know that you need to be looking forward. Your future is so bright. The things that's in the past, they're in the past. You can't do nothing about those. We live from those and keep moving forward. Thank you very much for your words of encouragement. Anything else you want to say right before we let you go, sir?
No, I mean, if anybody had any questions, I could add to it. But, you know, like I said, I just really try to bring awareness, especially these young people, and let them know it's all right to be a square. It's all right to be a nerd. I got kids that are saying, "Big Herc, man, do you play any instruments?" I'm like, "No, I wish I would have learned how to play the drums or guitar." They're like, "Man, I play the trombone." And I said, "Man, that's cool," because a lot of these kids, they feel ostracized, or they feel like they're weak if they play an instrument, or they're in band class or swimming class because they don't be caught in little swim trunks, or stuff that's like, why we're beating our kids up. You're killing their confidence, man. One thing I respect for Serena and Venus's dad, when I seen his documentary about those two girls that he told the reporter, when he said that Venus said she's going to win Wimbledon, and he's like, "You're going to win Wimbledon? How you think you're going to do that?" He said, "Hey, man, what'd she say? She's going to win it. Leave it at that. Don't question her ability. She told you she's going to win it. She's going to win goddamn Wimbledon." And she won Wimbledon multiple times. So my thing is, people are always questioning these kids. Do you know what that does to a kid? Right. What do you, you mean, it's not possible? Oh, nobody black's ever won. Oh, dang. So now they don't try. You done killed the trying ability. There's so many kids that would go into science, medical, different things if they felt like, hey, man, it's all right to be a doctor with a stethoscope, or to be an architect and to wear a suit. You don't have to wear your pants underneath your butt and have a big rope on and have a pistol to be cool as a black kid. You could be that cool kid who comes to work and has a briefcase and goes up into a 60-story building. You gotta expose these kids. And that's the difference. And as these kids, like, they have these programs where you take these kids and you take them different places. That one experience, I remember when I was in CYA, there was a kid there, and he came from a pretty good family, and he used to get all these different magazines and books in. And I used to look at them: Architectural Digest, DuPont Register, Raw Report, Malcolm X, different historic books. And he's like, "Hey, man, my dad, man, he has a Ferrari." I said, "What? A black guy with a Ferrari?" I said, "Damn, dude." He's like, "Yeah, man, he was going to drive it up here, but, I didn't want the guards to be tripping." I said, "Damn, dude, you got to have him bring it up here. I'd never seen a black guy with a Ferrari. I'd never even seen a Ferrari." And, like, sure enough, his dad already had a BMW, Lexus, Mercedes. He drove a Ferrari Testarossa to the visiting. And when I seen that, I'm like, God damn, man. I mean, you got brothers that are really doing it in a professional level. He was a medical equipment salesperson, making really good money. And so having that exposure, if you have somebody who can repeatedly be exposed to that, that's a game changer. And that's the biggest problem in a lot of communities, is having access and exposure to knowing what your potential is, because your potential basically stops once you feel that you no longer can go above and beyond, and you almost put the brakes on your own potential because you don't know any better.
Okay. Well, I want to take this time to thank you for your words of encouragement. I'm pretty sure there are some parents, because you not only spoke to the children today, you also spoke to the parents, and to be supportive of your child, whatever your child is going through, you need to be supportive. So thank you for that. And I want to take the time to thank you for giving up your Saturday to come and speak with us on this webinar.
Yeah, Herc, one more question from me. We live in an era of food deserts in our inner cities where people don't have access to good quality whole foods. We also have deserts when it comes to recreational areas for children, workout gyms and things like that. And obviously studies show that when you're in shape and you're eating right, your chances of getting cancer lower are a little bit, they decrease. So can you talk a little about the importance of exercise and diet in terms of cancer prevention?
Yeah, I mean, I would say, like, in areas where you have limited resources, as far as like a Whole Foods or a Sprouts or Trader Joe's, I mean, you can create community gardens, where you have community gardens where everybody kind of chips in, and you designate a little plot of land, a little plot of area where you can grow your own vegetables, maybe a fruit tree. I mean, a lot of times I would imagine cities should be able to allocate that as part of whatever programs to bring up those communities. So I would say that would be an option, and whoever's involved in community projects should look into that. And that would be a way to access, fresh fruit, fresh vegetables, and even having a chicken coop where you get eggs, where, you have certain farmers, because a lot of these farms maybe that are right outside the city, they have excess. And a lot of those eggs spoil or go bad, or they have different things that it's a write-off for them to give it away instead of throwing it away. So if somebody would take the time to maybe go and pick up these things once a week, you could have these at an area that's designated, and then have a day where people come out and they get free eggs and different things, so they can have this proper nutrition and learn about these things. Also with like areas like that, if they don't have like the gyms and stuff like that, I mean, I would imagine some of them have YMCAs and stuff, but just having say weekly education on just food nutrition, eating better, because like, the sugars, a lot of people, I remember going to Detroit, man, and the sugar drinks and just the breads and all the processed foods, all that is like basically a diabetic explosion waiting, and soda pop, a lot of these places, everything's soda. There's no, there's nothing natural, people aren't drinking the water. So, I mean, or even just the natural drinks, and these are some of the things that need to be incorporated. And for myself, I got into it because I've always I lived on a military base, and I remember watching seeing the Marines work out in the gym. These guys yoked up, orange shorts on, and I'm like, wow, and I've been inside a military mess hall and seen the food they serve. So I always was conscious, and I never was a kid who had to eat fast food every day. I didn't, have to eat cold cereal every day. I liked oatmeal. I liked, chicken, but I like baked chicken. So I kind of programmed myself. But as you introduce these things to people, which they don't know about, and you start telling them like, hey, man, you can eat this and eat that, and you can eat healthy for cheap, you can kind of shape and change people, but they got to want to make the effort. On the flip side, I ate healthy growing up, but I had a brother who didn't. And my brother, I could tell you, in his probably, when he was alive, his 20-something, 30, 40-something years, he probably never made a salad. And my brother, rest in peace, he did 7 years in the pen, got out, man, and 6 months later, he died. He had diabetes, he had a heart condition, he had kidney problems, and his diet, I can recall, fast food, Taco Bell, In-N-Out, soda pop, Monster energy drinks, Red Bulls, all these different things, high sugar content, didn't exercise like me, and I used to always tell him, man, take care of your health, man, take care of your health. And dude, he used to get mad at me, and now he's not here. So, people got to take their health serious, man. I mean, it's not a joke. And, it doesn't cost you anything to walk around the block, to walk and create these groups where you guys get up and walk, and everybody become familiar with the neighborhood and build that community, family value where you guys, hey, everybody get out and walk and know each other. And then, share different health tips. I mean, you can create things where on one day, this household cooks, this day, this household cooks, and then you share the food like they used to do back in the day. Everybody didn't have the money to buy all the food. So we all pitch in, and now we can, instead of having 2 meals, we have 10 meals and we pass them out. So now they're all packaged out and all the kids can have something healthy, and you space it out. So there's ways to do things, and you can still be healthy, and it's not going to cost you a lot of money. But like, health is the biggest thing. I see a lot of, older Black people, man. And my family, I tell them like, dude, oh, I'm tired. Oh, I can't do this. Oh, they're watching TV. And it's like, it doesn't take an hour of walking will lower your cholesterol levels, your blood pressure, drinking an extra gallon of water, just little things, man, taking the time to make a salad. Salad is cheap. Lettuce is cheap. Lettuce, you can get you some, roasted chicken for $4 or $5. You can make 5 meals out of that. It doesn't cost a whole lot, but you have to, pull together sometimes and work as a community so everybody can benefit and everybody has, you know, if you don't have the resource, me and you can work together and combine our resources and help those who don't have.
Thank you. I think it's time for Q&A. I'm sure people have some questions. I know there were some questions in the chat earlier.
Okay.
Kendra, do we have questions?
Yes, sir, we do. All right. The first question we have is actually for Carol Miner. The question is asked is, it's actually two questions. The first one is, if you're in your mid to late 20s and have never gotten the HPV vaccine, is there still safe to get one, or has the window closed for getting the HPV vaccine? That's the first question, Ms. Carol. Ms. Miner? I think
She
you're
may
on
have
mute.
stepped away.
Oh, she stepped away? Okay, then we will go to the next question that I got. I'm getting messages in the chat box, and I'm also getting messages in the Q&A. This message is for regarding colon cancer. The question is, what is the age to get your first screening?
Well, Dr. Ramachandran is not here at the moment, but I would suggest if you have a family history, you probably want to get your first colonoscopy around age 40, 45. If you have no family history, I probably suggest that the American Cancer Society also suggests age 50 for your first colonoscopy.
Okay, and the second question regarding colon cancer is the screening, is the age the same for men and women, or is it a difference? Does it matter?
That's a great question for the doctor. We'll have to get back to that.
Okay.
That person's question.
Okay. I have two more questions. They didn't specifically say who this was for. As we know, everyone's been dealing with COVID, been having trouble sleeping. Can someone give some recommendations on how to improve my sleep at night? Anybody on the panel want to take that question? All right, thank you, Nate.
Jump in there on that one. So yes, there's a couple of different things with sleep. First and foremost, you have to have a routine. We call it sleep etiquette. So basically you want to try to go to bed about the same time in the same area, wherever you sleep. So my thing that I tell my patients at work is like, the bed should be used for two things. One of them sleeping. Beyond that, you know, shouldn't be watching TV in bed, shouldn't be eating in bed. This forms a mental thing with your brain. When you go in, you go into bed to go to sleep. The other thing, Big Herc was mentioning Monster and Red Bull and all of these high sugar, high caffeinated beverages. We typically think of coffee when we think about caffeine. It's like, you know, no coffee after 5 or 6. It should be the same way with those high caffeinated beverages, because that can also make it really, really difficult for you to fall asleep. The other thing that you can do as a pharmacist, of course, talk medications, couple of Benadryl about 30 minutes prior to the time that you want to fall asleep should help you fall asleep. There are other medications and things that you can do as far as going to your provider and getting some things if you're having like real problems with it. But generally speaking, getting a nice routine down will help you fall asleep on a regular basis, and sleeping for the right amount of time. So, you know, set your alarm, get up at a certain time, fall asleep at a certain time. It may take you a couple of weeks, but you can definitely get it under control. Does that answer your question?
Yeah, I think that answered that question. And then we have two more. The second to the last question is, and I'm looking this way because I'm getting texts and I'm getting messages on the screen. What are you doing? Okay, the question is, I have started urinating more than usual, but I don't have a primary care doctor. The question is, should I be concerned, or and do I need to go see the doctor for this?
No, it's not.
So anybody want to answer that?
I can jump in on that one too.
Okay.
Absolutely. If you don't have a primary care doctor, man, woman, whatever the case may be, you definitely need to go in. That frequent urination, as a pharmacist, I typically think diabetes. It could be possibly something going on with the prostate as well. Usually I think of problems with urination, like inconsistent flow and things of that nature when we talk about prostate. But yes, if you don't, and this is for everybody that's watching, everybody that's listening, if you don't have a primary care physician, You need to get a primary care physician, go in, get checked out. I was having this conversation with some of my team members yesterday. A lot of people feel like, well, you're not sick until you go to the doctor. That's not true. You're sick, you just don't know about it until you go to the doctor. So going to the doctor is not what makes you sick. You're possibly already sick, you just don't know about it.
Okay, and then the last question that I have is, because of all of the myths and the distrust with the healthcare system for people of color in the community, how can you start building a good relationship with a healthcare provider? Like, what questions should you ask when you go to the doctor? So how do you get yourself ready to go to your doctor's appointment? For those that don't have a primary physician, or those that haven't been to the doctor in a while because of COVID, people have not been going to the doctor. So how can we get ready to move back? Because one of the things we're trying to do is get everybody back on track. So can you give us some tips on how can I get myself ready to get back into the doctor's office? And that's the last question that I have that's been texted and emailed to me. So anybody on the panel want to take it?
You know, men, there's a big barrier in terms of the healthcare system and men. And so for us, you know, that's always a challenge to get men to go to the doctor, but especially, you know, during a pandemic, I would say find a medical provider that makes you feel at home. I think a lot of times men don't feel at home within the healthcare system. They've never had a medical home. And so it's critically important to find a doctor that you trust in a place that you feel comfortable in. And if anybody else has any, that's more of a dialogue. That's a great question. And if anybody wants to pick up on where I just left off, please feel free to do so. Dr. Griffith?
Yeah, I mean, I think it's a great question. I think your answer was spot on. I mean, I feel like if you have to have a doctor that speaks to you in a language that you understand, and that it will take the time to answer the questions that you have. So it's about basically figuring out what are the things that you want to know? What is it that you want to know? How do you want that person to address the questions that you have? How do you want them to share information with you? Do you want them to, you know, direct you to other resources, or do you want them to just answer it without, you know, additional support? Definitely, I think somebody just put in the chat to write down the questions that you have. If you have concerns about trust and, you know, things that have done and the trustworthiness of that doctor, of that system, of that drug, as Dr. Boutte said earlier, you know, of the vaccine and so forth, then you need to ask those questions and try to get straight answers. So I think it really just speaks to, but you have to be comfortable, and you know the reasons that you're not comfortable. And so you have to get the answers to whatever is going to help you to have faith that that person is going to always act in your best interest.
Yeah, I'll chime in too on this topic, because I get asked this a lot in the pharmacy. And what I normally recommend to people is like, you know, hey, ask a friend. You know, if you have a friend or somebody that you do trust that does go to the doctor, like, which doctor do you go to? Why do you go to that doctor? And just, you know, find out, because they may feel comfortable with that doctor. Maybe, well, my dad went, or my mom went, or I ended up in the hospital and I had to go see a doctor, and this is the one that they sent me to. And, you know, I really like them for this, that, or the other. But, you know, a lot of times with healthcare, when there's a trust issue, the easiest thing to do is go to someone that you do trust, and then use that sort of as a trust extension. I know for me as a pharmacist, you know, we're super easy access, but we're not necessarily always trusted. You know, I've had patients come in and ask me questions, and then, you know, I start fighting Dr. Google because, well, right here it says to do this. So what you talking about? Like, you're right, it does say it to do that there. But then when I make a recommendation on, say, like an over-the-counter medication, like I just mentioned the Benadryl thing and sleeping, if that ends up working, a lot of times these people come back and now they've got questions about their prescription medications or their mom's prescription medications and so on and so forth. So again, it's just, you know, finding somebody that you do trust. And sometimes you have to build that trust. It doesn't necessarily happen right away. You're not going to just trust me because I've got on a white jacket and I went to pharmacy school or medical school, whatever the case may be. You may need some proof. So sometimes that takes time, and you can do that with a physician. You can go to a physician, have an appointment. If you didn't feel great about it, or you only felt okay about it, you don't have to go back to that person. But we do need you to go to someone so you can get checked out.
Thank you, panelists, for those wonderful responses. I wanted to go back. Someone did ask a question directly to Carol Miner, and she actually put her answer in the question and answer section. So I want to make sure I cover that because I don't want to not address this person's question. They asked is, if you're in your mid to late 20s and have never gotten the HPV vaccine, is it still safe to get one, or has that window closed? Also, is there an age where that window closes for getting one? And Ms. Miner's response is, Merck is the manufacturer of the HPV vaccine, and they have found that there are some efficiencies in getting the HPV vaccine through the age of 45. However, keep in mind that early uptake at the recommended ages before coming in contact with the virus is best. But by all means, do get the HPV vaccine for a level of protection that is better than never getting the vaccine at all. And Ms. Miner, I don't know if you're still there. I don't know if you want to add anything, but I just read your response. Okay. Those are all of the questions and answers that I have. And I'm going to turn it back over to you, Vance. Back to you.
All righty. No, I'm turning it back over to you. This is the time for the 42-inch television. So everybody's been waiting on this grand prize, and this is the time. You are the lady that we're waiting on.
Okay. All right. So we have, before we do the TV, we have to give away one more gift card. Then I'll do the TV, and then we're going to turn it over to Miss Judy. So let me pull my screen up. Let's get the wheel back up so everyone can see who is going to be a part of the drawing. So we have our wheel. So let's see who's going to get the last gift card.
Why not use my computer because it's already.
Are you trying to say something, Mike? Okay.
All right, Betty Miller is the winner of the last gift card. And now we're going to do the final drawing for the 42-inch television. So let me remove her from the wheel. Yep, remove her. And let's see who is going to win this television. Everybody's a winner today. Even if you don't win a prize, you are a winner. So let's see who is going to win this television. Helen Moore Robinson. Congratulations to all our winners. And now I'm going to transition and turn this back over to Miss Judy.
Okay, before I pass it over to Judy, I just want to thank everybody for participating in today's 14th annual Men's Wellness Summit. It's been my pleasure to be here in Memphis for the past few days, working with Judy and the other partners to make this event a success, and certainly look forward to next year's. And Judy, come on up here, join me. This is a better seat.
Yeah, I'm a little person, so I was kind of hiding out over there. Good afternoon, everyone, and it is indeed a pleasure to have this day be fulfilling. We had some great men and ladies, and it was a success because the information was so good. I've got a few people that are not using the chat, they are emailing me. And I'm getting quite a few of them. And everyone wants me to tell you, keep up the good work. Don't turn around. There's a lot to do. I want to announce that Saturday, June the 4th, 2022, will be the 15th annual Men's Health Summit. And my partner over here says we're going to be in person. We're going to be. I'm just going to leave it like that. And I do want to encourage everybody to pass it on. It will be on YouTube, and they know what to do when you get to YouTube. I'm not real good with that, but we will be there. And you can always call our national headquarters, which is in Washington, D.C. Just Google Men's Health Network. And when it gets to say something about muscles and all that, that's the wrong one. It's only talking about health. Google, go down just a little bit and you will find us. And please call the office, email or text. You can also do me. If someone will put my email address in the chat, I would appreciate it. It is Judy, menshealthnetwork.net. We appreciate all the time you spent. And once again, thank you. I am going to pitch it back to Reverend Vance Jr., who just got promoted again, so he can take us out with a prayer.
All right, thank you very much. I want to take this time to thank the Men's Network for asking me to be the master of ceremony for this event. I have had a marvelous time. I have received so much great information. To all of the panelists and the panels that spoke today, you did a marvelous job. And to Dr. Raj Ramachandran, we want to say again, congratulations for being chosen as Doctor of the Year for the Men's Network, which is a high honor. And we want to extend congratulations to you. So let us bow for the benediction. God, we just thank you for this day. We thank you for all that has went forward, all the words, all the information. God, we just thank you for us being here today to share about life and how to live life and how to live life fully. God, we are grateful to you, this knowledge. God, we thank you for the sun that shines and the moon that rises. God, we give you praise forevermore. In Jesus' name we pray. Amen. Bless God. And you have a wonderful day. And thank you for joining the Men's Health Summit 2021.
Praise the Lord.
All righty. Y'all all right?
Yeah, everybody want to wait. Thank you so much.
What do we have to do, Vance, Reverend Stacks, in order to get you on board next year in person?
That'll be fine.
I'll buy you a lunch. What, lunch? Dinner? What's it gonna take? Because you did a great job.
Food always bribes me. You know that.
Same here. I know. I feel that. So thank you.
We will get that. And Dr. Boutte, I need to touch you because you're really lucky. And thanks for your expertise.
Yes.
And great job filling in. You just jump right in there and you fit in just like a hand in a glove. I pray.
Everybody was great, and you all will be hearing from me say Monday. I'm gonna try to have a little surprise for all committee members. Once again, thank you, and thank you, David, wherever you are there. I don't see you on the screen. I'm assuming you're there someplace because we're
I am
still
here.
up.
Thank you so much. Yep.
Okay, I think we can say goodbye. Everyone have a blessed Saturday and the rest of your weekend. Bye.
Pink ain't what you think.
No, you ain't. On the main line. That's all I gotta say.